So if you're at home and you're worried about if you're putting the right thing on your wound, I hope that through this presentation you will get some confidence about what you're using on your wound, and or maybe realize it's time to make a change. My name is Dr. Heather Flexer. I'm a doctor of physical therapy and a certified wound specialist. Thank you for joining me today. So there are so many things on the market, right? You can get super confused, and maybe your wound isn't getting better because you're using a weird combination of things or at the wrong time, or you're just changing things too often. This can be a big problem, and I hope that you will feel more confident. It doesn't need to be tricky. So first things first, if you just had surgery or you're working with a physician, you're going to follow MD orders, especially immediately after surgery. If your doc was able to close up your skin and you have a good, clean, closed incision, that is ideal. Usually those wounds are going to heal pretty easily. If your stitches open up, you should be contacting your surgeon and letting them know that you're having an issue. And following the recommendations that they give. Now, if your wound is open for longer than 30 days, then you have what's considered a chronic wound. And just like I'm not a surgeon and I don't have any idea how to do surgery, sometimes your surgeon just really isn't as well versed in wound care dressings or advanced products. And so if you have a wound that's open for more than 30 days, I would suggest you get in touch with a wound care specialist in your area, because they may be able to help you heal a little bit faster. One of the big complaints I get from clients is that they wish they had talked to a wound care specialist sooner, and that they hadn't just said, oh, it's going to be fine, and they had been using gauze the whole time. So there's way better products if you have a non-healing wound. So in most cases, what you want to be doing is moist wound healing. That's actually the standard of care. That's not really gauze. Gauze isn't really a moist dressing. Even if you're putting saline in it, it tends to dry out pretty quick. So we're talking about some different products and we'll go through them. But keeping your wound moist and covered is going to be less painful for you, and you will have a shorter healing time. So your wound is going to close up faster. A lot of times I will see folks that are just used to letting things air out, and actually that will cause wounds to be a little bit more painful. The scar will be a little worse, and it's going to take longer. Nobody has time for that. So keeping your wound covered is a good rule of thumb. And that is, of course, as long as you don't have any active infection. So we wouldn't want to like close bacteria in and like seal it in, and then the bacteria has nowhere to go but into your body deeper. So if you have an active infection, that's something else. And one of the other caveats is stable eschar, and that's something that we'll usually see, like the black heels, and we wouldn't necessarily want to open them up, and that's what moist wound healing would do. So that's just another situation. So if you have a poor likelihood of healing, we don't necessarily want to open the wound up. But if everything is pretty normal, we want to do moist wound healing because it's going to get the job done faster. And wound care is truly a balancing act. We're trying to balance between too wet and too dry. So the idea that one wound care product would get you from a big open wound to all the way to closing just really isn't going to happen. You're going to have to change products somewhere along the way. Now, a dry wound, these are examples of dry wounds, need extra moisture. So the first one is more of a scrape, but it's got like a little dried blood on there, and the body will get rid of that dry, dead blood if it's covered and kept moist. Now, you don't necessarily need any special fancy ointments or salves or anything. Probably just a bandage would. This was probably in a young, healthy person. and just keeping it covered would probably produce enough fluid. Now, if you're a little bit older or you've had this wound for a little bit longer, then you may be looking at needing some ointments and things to help to add some moisture in there. And a really safe option is a hydrogel. Now, on the other wound, that is more of a fully necrotic wound. It is starting to peel off. So this one is indicating that it needs some debridement. There's a whole ton of ointments and things that will do some form of debridement. We'll talk about that a little bit later. But basically what we want is to add moisture to that wound, because then the body's going to allow it to slough off. And all our wounds close from the bottom up and the outside in. And if we have a big old hard eschar clump on top of it, it's never going to heal. So we have to get that off. And we're trying to donate moisture to dry wounds. So you need to rehydrate that wound. That will allow that to come off. And that's going to help in debridement and cell migration for healing. And usually it's kind of soothing because, like even that scraped wound, that's going to be a little comfortable. So we're adding a little moisture and allowing the tissue to move. When it's dry and cracked, like you've had a scab before where it just hurts to move your body because it's dry and it hurts. So adding a little moisture will help with that. And this is just a picture of hydrogel. So hydrogel comes, this is like an amorphous gel, so it doesn't have shape, it's just in a tube. You can do a thin layer, or sometimes you will need to use packing, and you'll have to add it to packing. And there are, of course, like I said, a ton of different products on the market. Hydrogel doesn't have any additives in it, like there's no antibacterial properties, and that's fine. Like if you don't have any signs of infection, then go ahead and use just a plain old hydrogel. And if our wound is wet, we need to soak up that drainage. So if you're having leaking from your incision line, you want to use something that's going to absorb fluid from there so that the fluid isn't breaking down that tissue. We want the fluid to get pulled into a dressing. Same thing here. This one is leaking quite a bit, but that's only in that one little area. And we want things that are absorbative. And there's a whole host of products on the market. A lot of it's going to depend on what you have available. Gauze is not that absorbent. It doesn't really hold a lot of fluid, and it doesn't provide a bacterial barrier, like you can see through it. Plus, it's those gauzy fibers. If you have a deep tunnel, then they may cause some other issues in there. So gauze isn't really like the best dressing out there. We've got things like calcium alginates, which soak up 20 times its weight in fluid. We've got foams that are nice and comfortable and conforming, and a lot of them come with waterproof backing. So you could shower if that's an option for you. And they're designed to stay on for a few days. So it really just depends, but there are a ton of dressings on the market, and they will do a good job, if you find the right one, of soaking up that drainage. Now, one of the other things about wounds is that any depth, which is like how deep it is, like how deep in the hole it goes, tunneling, which is like, it sounds like a tunnel headed into another direction, and undermining, which is perpendicular to the surface of the skin, so it's usually caused by shearing forces. If you have these empty spaces, they need to be packed in. So we're not jamming the packing in, we're just lightly laying packing in. I have a little video at the end, but we do want to fill that dead space because, like I said, the wounds need to fill from the bottom up and the outside in. And if you happen to have like a little cavity and the top of the skin comes and grows across, because that's just the easiest way for the wound to grow across, now you've got this abscess or hole in there, and that's you're asking for an infection, an abscess, or some other issue. So we want to pack that fluid, pack that hole with some kind of packing material. And you can use it depends again on if the wound is dry or wet, what you're going to put in there. Sometimes you'll put some hydrogel on packing strips and put it in there if it tends to be dry, or if it's really exudating a lot, you're going to use like the calcium alginate ropes or things like that, other options. It depends on what you have available, what's in your budget. If you work in a facility, you know, what's there. Lots and lots of options. The only thing you want to be careful of is not like jamming the packing in. You want to just like lay it in nice. And you can always leave a little tail like that picture shows, a little bit out, so that the wound couldn't like completely close and you couldn't like lose whatever you pack in there. So whatever you put in there, you want it to be like one continuous piece, not that you cut a little bit, stiff some in, cut a little bit, stiff some in, because then you don't know if you're going to get it all out. So whatever we put in, we want to make sure that we can get out. Now, a lot of the wounds are going to need debridement, and that basically just means that we're removing dead tissue. And both of these have examples of needing debridement. One has some fluffy eschar looking tissue that's going to need to be removed, and there's various methods for debridement. And then the other one has this really wet, round, it looks like a very chronic wound, and that is something that is also actually going to need to be debrided in order for you actually to close all the way. So there's tons of ways that debridement can happen. Moist wound healing is one because it causes autolytic debridement, meaning that the body's fluids is going to help loosen the dead tissue and help you remove it. Sometimes folks need to go into surgery, like that one with the edge might need to go into surgery to be removed. Sharp debridement just means using some sharp tools. So nurse practitioners, physicians, physical therapists, if they're trained, can do sharp debridement. So it's literally just using a scalpel to scrape or cut some dead tissue off, or there's different tools like curettes. And an enzyme is just an ointment that has enzymes in the ointment that are going to help to eat up that tissue. Those work really well as well. And mechanical debridement would be like scraping the dead tissue or the biofilm or whatever is on there off there. And that can be done during some cleansing. So a lot of times there is some form of debridement happening, lots of different forms happening in one wound case. So it might not be a one and a done, there might be a combination of debridement methods that are used. And if we're infected, we absolutely need to get that checked. If you have any concern, if there's redness, if there's odor, if there's pain, these both appear to be pretty infected and inflamed. You can tell the redness around. That one looks pretty, like you can smell it, right? Like it looks like it doesn't smell good. And that's probably the case here. And then this is a knee replacement that looks like it's pretty infected as well. So we're looking for those signs of infection. If you have any signs of infection, or you're concerned that you might be infected, you want to call your doctor. And I know right now there's lots of options for you with telehealth, and you can maybe even get what you need, your antibiotics, without even leaving the house. So that's a great option as well. If you're ever concerned about an infection or a wound in general, I suggest taking some pictures in some good lighting, because that's probably what someone's going to ask you for. But you're going to look for your signs of infection, pain, fever, drainage, odor. If you're not feeling good, just like you feel like you have the flu, that is usually a good indicator that you might have a systemic infection throughout your body. So you want to get that taken care of, taken a look at right away. I'll show you a little demo. I'll go back to this later. It's available I'll put this in the comments for you to check out. But you always want to follow your doctor's guidelines first. And if you have any changes in drainage, pain, swelling, any of the signs of infection, make sure you get that checked out and follow up with your doctor. Always let your doctor know. Dressings will need to change over time. So as a wound heals, it may be it may drain a lot in the beginning, and so you'll need a calcium alginate or something like that in the beginning, and then the wound should close. So we would expect that maybe eventually you're only using some salves or a light bandage to cover it and keep it protected. But that's normal. That's what we want. Our dead spaces need to be packed. So if you have any depth in your wound, you do need to be filling it in. You don't want to just like lay a cover over a hole and have like a hole. We want to fill that space. If you have any issues, if your wound is not progressing, so like the size isn't getting any better, the drainage isn't getting better, the pain's not getting any better, and it's been more than a month since your initial injury or surgery, you want to look for a wound care specialist. They may be able to help advise you and even let your physician know what they're recommending. And thank you for joining us. I hope you learned something today. I am a wound care specialist. I do video consults. If anyone needs me or wants to set up an appointment, I'm more than happy to, and I'll put that information below. There's some references about what we were talking about, but I really appreciate your time today, and I hope you learned something. And if you need anything, please reach out. You could find me at Better Wounds on YouTube, Instagram, Facebook, and I look forward to working with you again. Bye.